HIPAA compliance is about protecting people's health information and being able to prove that you're doing it. First, a quick correction. People often say HIPAA, but the correct name is HIPAA, the Health Insurance Portability and Accountability Act. It's a U.S. federal law enforced by the Department of Health and Human Services through the Office for Civil Rights. At a high level, HIPAA exists to protect trust. When someone shares health information, misuse can cause real harm. HIPAA sets rules for who can access that data, how it can be used, and what must happen if it's exposed. So what does HIPAA actually protect? It protects PHI, or Protected Health Information. PHI is health information that can identify a specific person. That could be a name linked to a diagnosis, an appointment record tied to a patient, or a billing file connected to care. It doesn't matter whether it's written on paper, spoken out loud, or stored in a computer. When that same information exists electronically, it's called ePHI, and that's where most enforcement happens today. HIPAA doesn't apply to everyone. It applies to two main groups. The first is covered entities. These are healthcare providers, health plans like insurers, and healthcare clearinghouses. The second group is business associates. A business associate is any vendor that creates, receives, maintains, or transmits PHI on behalf of a covered entity. That includes cloud hosting providers, billing companies, IT support firms, telehealth platforms, and many software vendors. A simple test is this. If you touch health data for a provider or insurer, HIPAA likely applies to you. When people say HIPAA compliant, they often imagine a single checklist or a piece of software. That's a myth. HIPAA compliance means rules, safeguards, contracts, training, and documentation working together. It's an ongoing program, not a one-time task. HIPAA is built around several core rules. The privacy rule controls who can use or share PHI and for what reasons. It allows PHI to be used without special permission for treatment, payment, and healthcare operations. It also gives patients rights, like the right to access their records. A key idea here is minimum necessary. Outside of treatment, you're expected to limit access to only what someone needs to do their job. The security rule focuses on electronic PHI and how you protect it. It requires administrative safeguards like risk analysis and training, physical safeguards like controlling device access, and technical safeguards like unique user accounts, audit logs, and encryption. A risk analysis is foundational. Regulators regularly fine organizations that never did one, or did one once and never updated it. Another important detail is that addressable safeguards are not optional. You must implement them or document why an alternative achieves the same protection. The breach notification rule explains what happens when PHI is exposed. If unsecured PHI is accessed or disclosed improperly, you usually must notify affected individuals and the government, and sometimes the media. Encryption matters because properly encrypted data may not count as a reportable breach if the keys weren't compromised. The enforcement rule explains how violations are investigated and penalized. Fines can be large, but what often hurts more are corrective action plans that require years of reporting and oversight. Contracts matter too. If a vendor is a business associate, you need a business associate agreement, or BAA, before PHI is shared. A generic terms of service agreement is not enough. Missing BAAs are one of the most common HIPAA failures. In practice, HIPAA compliance looks like knowing where your health data lives, limiting access based on roles, training your workforce, securing systems with controls like MFA and encryption, preparing for incidents, and documenting everything. Evidence matters. Regulators don't just ask what you intended to do, they ask what you actually did and what you can prove. HIPAA isn't perfection. It's about reasonable, documented, and defensible protection of health information. If you understand who it applies to, what data it protects, and what the rules actually require, you're already ahead of most organizations that get into trouble.